And good morning, everyone. Thanks for joining us for this Monday's COVID-19 press briefing. Today, Orange County Mayor Jerry Demings will start with our goals for the week. It's good to have some priorities lined up. He will also discuss the county's assistance and deployment as it relates to Hurricane Ida. Mayor Demings will give a COVID-19 update where we stand as it relates to vaccinations and the always important testing. The mayor will discuss the county's emergency rental assistance program and will have information on our after-school programs which are taking place. Dr. Raul Pino is here from the Florida Department of Health. Happy to see him. He will report on important COVID-19 trending information here in Orange County. We will begin with Mayor Demings. Mayor?
Good morning. Buenos dias. Bonjour. There's a lot going on in America, isn't it? With this weekend's activities in Afghanistan and now with the issues that our nation is facing in Louisiana. And as those who live in that area are going through the aftermath of Hurricane Ida, Category 4 storm that made landfall with winds up to 150 miles per hour, we know that they have been significantly impacted in that area. Earlier today, the Florida Task Force 4 was activated, actually yesterday afternoon, and deployed this morning. Right now, they are headed to Louisiana and will know their exact assignment later this afternoon. 12 Orange County firefighters and command officers are among those in the Central Florida Deployment Group. That includes our urban search and rescue personnel. They were from other departments such as Orlando, Seminole. Wish them Godspeed as they help hurricane-stricken residents recover from this historic storm. Ironically, this also marks the 16th anniversary of Hurricane Katrina. I had the opportunity to deploy to that area when I was the Orange County Director of Public Safety, along with the sheriff at the time and the regional FDLE director, into the Mississippi, Louisiana area. And I can tell you I saw the devastation of Hurricane Katrina firsthand, and I know that it is a significant event for those who live in that area. And so when our personnel deploy into that area, they are indeed going into harm's way, so we certainly hope for the best for everyone that's involved as well as our personnel. Now let me just turn to the pandemic that we're currently also dealing with every day. Another Orange County employee, sadly, I have to report, died from COVID-19. This makes the 5th Orange County employee that we had that died. This employee I know very well because she worked in my office. So we know that this is a dangerous disease and it continues to claim lives, and we must all continue to do our part to bring it under control. Of course, we know that by getting vaccinated, that's a great start to helping to protect yourself. And the second thing is obviously to continue wearing your facial coverings. So this week, every Monday when we start, I try to tell you what are the goals for the week, and so I'm going to do that today as well. Our number one goal is to continue to stop or slow the spread of the novel coronavirus called COVID-19 and its mutation, the Delta variant, from spreading within our community. Number two, our goal is to ensure that we have adequate testing available for those who want to be tested within our community, and we are doing that through a myriad of means here within our county. And number three, we want to continue to offer mobile vaccine opportunities through the I Got My Shot trailers as they will move throughout Orange County. Dr. Pino is going to talk more about an operational change there, but I will say that you will see not only the marked trailer, but there will be other unmarked trailers that will be deployed throughout the county. And number four, our goal is to continue providing financial assistance, emergency rental assistance to those who are in need within our community. And let's talk briefly about the numbers. There are now over 200 206,000 coronavirus cases reported in Orange County. In fact, nearly 207,000. The number that Dr. Pino has shared with me is that we have 206,686 documented cases within our community. In July of last year, in 2020, we had 23,000 cases. And here we are at over 206,000 cases. The number of deaths in Orange County is 1,533. That's 34 more deaths than we reported to you on Thursday at our last press briefing. So there's good news and the bad news, and I'm sharing with you. If there's any good news, the 14-day positivity rate has decreased to 17.86%. So it's a promising sign that we have plateaued and the numbers of new cases are beginning to decline. The number of residents ages 12 and up who have at least one shot or more of the vaccine stands at 66.81%. So nearly 67% of our residents now 12 years of age and older have received the vaccine. Our Orange County Health Services testing sites continue to see thousands of people at their 3 testing sites. On Saturday and Sunday, they administered 7,448 tests just in those 2 days. So the demand is extraordinarily high for testing. Individuals can get the rapid antigen or PCR test for COVID-19 at these locations. The locations of the 3 Orange County Health Services run testing sites are Barnett Park, the Econ Soccer Complex, and the former Claricona Elementary School in Apopka. The testing sites are open 7 days a week between the hours of 9 a.m. and 5 p.m. Again, you can get information from our website at ocfl.net/testing. Camping World Stadium continues to offer the Pfizer or Moderna vaccines. Over Saturday and Sunday, 376 individuals took advantage of the free vaccinations at that site. Again, you can get information about the vaccine sites by going to ocfl.net/vaccine. And now I'll talk about our rental assistance program. We know that individuals in our community continue to have a need for rental assistance during this pandemic. Some 1,350 plus families have taken advantage of our emergency rental assistance program. We have provided over $7.5 million in approved assistance. The average approved applicant has been receiving roughly $5,540 to help pay back rent. You can get information on the rental assistance program at ocfl.net/rental assistance. I talked about the mobile trailer already, but the locations that we will be at starting at 1 p.m. today, the mobile trailer will be at the Savannah Court in the Maitland area off West Maitland Boulevard. Tomorrow, vaccinations will be given at 2 additional locations. Kelly Park and Apopka will host a trailer Tuesday morning. Then it will move to the John H. Jackson Neighborhood Center on West Carter Street in the Apopka area between the hours of 3 p.m. and 6 p.m. On Wednesday, vaccines will be available in the morning at Lake Eola. On Thursday afternoon, the mobile unit will be back in the Apopka area at the Hope Community Center on North Park Avenue between the hours of 4 p.m. until 7 p.m. As far as the upcoming weekend, the vaccine trailer will spend Saturday morning at the Maitland City Hall. Then on Sunday, it will be back at Lake Eola at the Farmers Market. I want to make an announcement regarding our after-school programs. Our Parks and Recreation Division has been working hard to ensure the safety of children and staff involved in the county-run after-school programs. Due to an increase in COVID-19 cases in our community, and especially amongst children, effective today, we will be requiring that the 300 plus children who participate in our program must wear a face mask while indoors as a public safety protocol. Children outside will not be required to wear a face mask. This new requirement is consistent with the guidance from the Centers for Disease Control and Prevention. Face masks will be provided to those who do not have one, and we will continue to follow social distancing, sanitation, and frequent hand washing procedures at the after-school programs at 13 park and recreation sites. And now I'll turn it over to Dr. Pino for an update on the specific numbers. Dr. Pino.
Good morning, Mayor. Thank you. Good morning, everyone. So the Mayor mentioned to you several points that the data is indicated that we may have already peaked. We mentioned to you a few weeks ago, maybe 2-3 weeks ago, that we were starting to see those signs. And if those signs continue, we have peaked in week 32, We are on week 34. But I will give you more data on that. The Mayor mentioned to you that we have a total number of cases of 206,686. Out of those 892 were residents of Florida. And the number of deaths has risen to 1,533. The positivity rate for the last week average was 16.1. And I'm going to tell you why I mentioned that number. With regard to the infectiousness, our incidence rate per 100,000, the highest we got was to 634 individuals per 100,000, the lowest we ever been since the pandemic started. It was at 54 on week 24. Last week, we are at 544, so it's been a decline in the positivity rate as well as the number of cases per 100,000. Yesterday, although Sundays are not the best day to measure the pandemic and the test results, we received 823 new cases reported to the state. On Saturday, was 1,057, and on Friday was 1,207. For yesterday, 19% of all cases continue to be the highest number of contribution by age group, and that is 5 to 14. 5 to 14 years old represent 19% of all cases, which is 155 cases. That is to assume that those are students or at least individuals in school age. The last 2 weeks, week 33 and 34, we have seen a negative growth in the number of cases. On week 33, the negative growth was -7. In week 34, the negative growth was -8. With regard to positivity rate, the highest we got was 20.5 on August 19. Today, on August 29th, the 14-day rolling average is 17.8, and the daily positivity rate for yesterday was 14.01. With regard to the number of deaths, that's a data point that we always mention to you. It will lag a little bit. So since Thursday, 34 deaths have been reported that are Orange County residents. One of those was transferred to Miami. I have to see what that will do to the total. That's normal. We always analyze every single case and go through it and determine if they are our cases. For those, 17 were female, 18 were male. The age of those who passed since Thursday, or reported at least, age 23 to 95. 27 have known underlying conditions. 8 didn't have any underlying conditions. For the monthly count of death, I was stand at 107, which is basically double the ones in July. July, we have a total of 58. In June, which was the lowest since we started vaccinations, was at 31. So June 31, July 58, August so far 107. And remember that even in September, we will continue to receive cases from August. So it would be safe to assume that in the first 2 weeks of September, we are going to see a number of cases that belong to the August data. With regard to vaccination of the eligible residents with 1 dose or more, we are at 60.8% of those. Another group that we closely monitor is 12 to 17 because they are only school-age students that are authorized to get the vaccine, and that for 12 to 17 stands at 53.10%. I just want to give you the data for age group. Just for people who are 65 plus, we are basically technically an 85% vaccination rate, which is the highest among all age groups in our county. With that, I will answer any questions that you may have. Thank you.
Okay, before we will have a microphone that will be moving around, so that will be the order in which we will take the questions. If there are any questions in Spanish, I will have Elio Torres come forward to translate for me. Dr. Pino certainly is fluent in Spanish. And just to note, we do have Mr. Scott Howard here from the Orange County Public Schools who can certainly respond to any questions. We also have Dr. Yolanda Martinez here from Orange County Health Services, and we have Commissioner Maribel Gomez Cordero who has joined us. And for those of you at the conclusion of the press briefing today, we'll be making some additional presentations to our local media partners who have been with us throughout the pandemic, who have been covering the various events and announcements that we've done to date. So I just want to say thank you to those additional local media partners who are present with us at this time. And with that, we'll open it up, and the mic is in the front, and so we will move forward in an orderly fashion that way. All right.
Lauren Seabrook, Channel 9. My question's for Friday. We reported on the local hospitals receiving 14 portable morgues. I looked at the state numbers. It looks like hospitalizations are starting to fall. Curious if you guys have been in touch with our local hospitals to kind of see where they're at after this weekend and if those morgues were able to be delivered.
You mean the cooling units or what have you? Yes, the Florida Disaster Medical Association provided some portable refrigeration units that were deployed here within the Orange County area to provide some relief to hospitals and or the crematoriums that are here within the area. And we continue to monitor the situation through the Orange County Medical Examiner's Office, and Director Banks has been instrumental in that process and has been working behind the scenes with the hospitals, the crematoriums, and our medical director's office on that.
I don't have any additional information on that.
Okay, Danny, what's the number that was deployed? I think that was part of what Lauren was asking also.
Good morning. There were 14 different portable morgue units brought in to support both Advent Health and the Orlando healthcare organizations. Our medical examiner's office did also last week offer some of our own opportunities to assist both of those healthcare organizations. We were able to provide some space for both Advent Health and Orlando Health for temporary storage of some of the deceased. So again, we'll continue working with them through this week to provide some of those resources as they need them.
Okay, thank you. We'll move to the next question.
Yes, Jesús Manuel Torres from Acción 979. Doctor Pino, precisamente mi pregunta era sobre eso. El estatus actual de los hospitales en la región. Hay mucha preocupación de la carga que tienen los doctores, las enfermeras. ¿Qué está ocurriendo con eso? Si tiene alguna información. Y segundo, según su experiencia y la data que ha compartido con nosotros ahora, ¿cuándo se espera que comience a bajar ese % de positividad?
So the questions were, what are we doing and what are the conditions in the hospital? And if we can mention that to the Latino community in Spanish. And also, what was the second part?
Si tiene alguna, de acuerdo a la data que ha compartido hoy, ¿cuándo podemos experimentar
And based on the data that we shared today, when are we going to experience a decrease in the number of cases? Keeping with tradition, taking the second one first. I think we are experiencing that already. Perdón. Yo creo que ya pasamos el pico de los números de casos. Lo que me preocupa es el holiday que viene este fin de semana y que la gente tiene que mantenerse y seguir las instrucciones del CDC, so de que no incrementamos el número de cases por encima de lo que ya ha ocurrido. So my answers were, with regard to the number of cases, they are declining already. But my concern is with regard to the holiday coming this weekend, and people need to adhere to CDC guidelines so that we continue to see the decrease in the number of cases. Con respecto a los hospitales tienen todavía un poco de capacidad acá. El problema que tienen los hospitales es lo que tú decías, los empleados. Están cansados, llevan un año trabajando sin parar, y eso es lo que limita la capacidad del hospital, porque no es solamente una cama como un hotel, también necesita la enfermera, los equipos que van con esa cama, el oxígeno y todo lo que viene. Hemos visto una limitación en la habilidad, pero ellos estaban diciendo hoy que ha disminuido el % de casos que tienen hospitalizados. With regard to the hospital, the question was, the hospital has reported that they still have capacity, but part of the issue that the hospitals are facing is employees, personnel, that is extremely tired, exhausted, and they need to take a break so that they can continue to provide those services. And those are very intense services. They are very draining for anyone who experiences this type of work. And the fact it is that although they have said that they have this capacity, the percentage of people with COVID-19 has lately decreased a little bit, in part because there has been a decrease in the number of infections, but also because there has been an increase in the number of deaths, and that unfortunately also provide additional space in the hospitals.
I have a two-part question. I know we've been getting information from you guys on what the wastewater is showing. Is the wastewater showing that this trend of cases going down is going to continue? And are you worried, while it's good that the numbers are going down, that people will think, maybe I still don't need to get vaccinated, and they'll kind of pump the brakes a little bit on some of the precautions?
I mean, that's risk communication at best. How can we provide the information that we need to provide, be transparent, because we have to. So in order to keep people getting vaccines, I should not be lying on how the pandemic is doing. In that sense, you know what I mean? I have to give both. Now, these are probably the results of an increase in vaccination rates. These decreases are probably a result of some of the emergency procedures that the mayor put in place. And with prevention, it's very difficult to know what is attributed to what. But the reality is that we have a multi-layer approach that includes vaccination, masks for those who are using, a hand sanitizing, spacing, but also including elevating the community collective consciousness of the need to protect ourselves and protect others as well.
The only thing that I would add is but one indicator when we do the waste water analysis. Keep in mind, we have a number of people who do travel here. We're still probably the #1 tourist destination. And as such, in our wastewater systems, we can have the prevalence of various variants that show up in the testing that may not directly correspond with the resident numbers, because those individuals who travel here go back to wherever they are, and if there's any related transmission to that, their numbers are likely going to be counted somewhere else. However, Dr. Pino, through the health department, through the national CDC, data is shared if there's any outbreak that's associated with an event here, he would likely have that information. So I think we're looking at two different things. It's just one of many indicators that we will use to help us make some decisions here within our community. But I think the best indicator are the data that we receive from the testing and the data that the Florida Department of Health here in Orange County collects and then provides to us. But we also are in regular communications with our hospitals. And so the hospitals see a number of individuals in their ERs and by which to make decisions from as well. So I joined Dr. Pino, and our job here is not to sugarcoat what is going on, but to give accurate, timely information and feedback to our community as we continue to manage through this pandemic.
Can I follow up real quick, because I think my question might have come across wrong. Are you afraid people are going to pump the brakes when they see numbers are coming down? Obviously, you need to report the truth, but is there a message that you want to get out to people? I mean, obviously, it's going going away.
Okay, I think I understand the question is, am I afraid that people will relax and not continue to be vigilant and getting vaccinated and doing all those other things? This is why we try to make sure that we communicate to our community and we elicit the assistance of all of our media partners there that we still are at a very high rate of transmission. While I said earlier, there's good news and bad news. The good news is the numbers are coming down. The bad news is they're still really high. So it is no time for us to sit back and rejoice and relax, because if we do that, then we're going to shoot ourselves in the foot and the numbers will go back up. So we still are highly encouraging people to get vaccinated. I think that is a number one thing that we want to encourage those in our community. We're still continuing to try to get that rate of transmission up. And from talking to the experts like Dr. Pino and others here within our community, the longer we go before we reach that herd immunity, the more likely there will be a new mutation that will come. And already I was reading today that there's a new mutation in Africa that they're studying and evaluating and don't know yet, but just like the Delta variant came upon us and it was much more aggressive in terms of the rate of transmission, we don't know what we don't know. So it's still in our best interest to get as many people vaccinated in our community and really across America and across the globe as we possibly can, because that is the way where we can truly control the potential for mutations to occur. Okay. All right. That was your question. Okay. All right. Got it. All right.
Just questions for Mayor Jerry Demings, just cause when he's 13. Now, over the weekend, Advent Health sent a letter to Florida emergency managers saying those coolers that they received are quickly filling up, and they think a part of the backup is because of slowdown at local funeral homes is causing this to happen. Have you been in touch with any local funeral homes about the situation at their morgues? And also, Dr. Pino, can you go over again about that positivity rate among 5 to 14-year-olds, and what does this mean for area schools?
So to answer your question first, yes, we do hear from some of our funeral homes, and this past weekend I had the opportunity to attend a viewing of one of my classmates who died of COVID-19. So while I was there at the funeral home, what I noted was the fact that they were full. There were, whereas sometimes for the viewings there would be a single body in the room, and some of their rooms they had two people that were in a room. And so that kind of suggested to me that at least with that one funeral home, they are seeing an increase in the number of deaths. I don't know whether they are all COVID related or not, but I know that the one that I was there for, as a matter of fact, not only was my classmate, there was another individual that had a father came up to me, and his daughter, I believe he told me she was 31 years old. She had passed of COVID, and she worked for a county constitutional office. And so, that's what we're dealing with. Okay. Dr. Pino?
Yeah, with regard to your question with the schools, thank you for that question, because it's a good reminder to parents that the exposure to the virus is not limited to the schools. It's the same community. So the steps that we are taking to protect your children in school should be something that you also model and follow at home. Because the reality is that in this type of environment, it's very difficult to determine where was someone exposed, because it's everywhere. And to make that determination, although you can make it happen sometimes, you have to have some level of certainty that that was the only possible contact with a positive person. And that's part of the issue, that we have to continue to protect our children even after schools, because a school is not the place where the virus grows, and is in our community. It's everywhere at this point. And with the positive rates that we have and the transmission rates that we have, it's going to be difficult if you don't take precautionary measures. It's very difficult not to get it at this point if you don't take the steps. Because again, it's everywhere, but it's not limited to the schools.
Okay, where's the mic?
Right here, right in front of me. Sorry about that.
There it is.
It's Steve Hudak from the Orlando Sentinel, and this question is for both the mayor and for Dr. Pino. So we've talked about perhaps our infections have peaked, perhaps now. When will we see our peak in deaths? I mean, hearing 34 more deaths since Thursday is pretty startling. And I think you told me the other day, Dr. Pino, there were 10 overnight from Thursday to Friday. So when will we hit that peak? And the other thing about that is, can you give us I know you gave us a range, but what are we talking about? Are most of the people dying still over, like my age, like 60, like I'm almost there, like 60 and over, or are the average age younger?
So there has been definitely younger people dying lately. Not that many, to be totally fully honest. Now the median age for those who died in August is still at 71. But just a reflection of that, so people understand, if someone really old died, 95, or someone really young die, and I don't want to give a number to that age, but the younger the people die, it drives down the median age. So it could be that you have one or two cases that are really young and drive down those numbers, or you have a few that are really old and keep that number up. And that's why the number is at 71, because we have a higher number of older individuals dying that's what is giving us the median age. The peak, I don't think that you will know the number until probably the second week of September, because the experience is this month. We continue to report a few cases from July up to the second week. What the number is going to be, we can make some predictions based on rate. I don't have the rate in front of me per number of days, but as it's going, we probably will get close to 120, 125.
Omar Machuca, de Telemundo. Doctor Pérez, doctor Pino, hablemos de la situación de los niños. Usted dice que los niños de 4 en adelante son los que más están contagiando. ¿Qué representa esto para las escuelas y qué representa esto para los padres? Muchos de ellos no quieren que los niños lleven mascarilla.
La pregunta tuya con respecto a las escuelas es la misma respuesta anterior. Los padres tienen que darse cuenta que la escuela no es el único lugar donde hay infecciones. Está pasando también en la casa, está pasando también en la comunidad. Poco vamos a lograr si el niño va a la escuela y es protegido, y regresa a la casa y no está protegido. Y la protección significa, dependiendo de lo que los padres decidan, lavarse las manos frecuentemente, no tocarse los ojos, mantener la distancia, proveer una máscara si ellos deciden utilizarla. Y esas son las situaciones que van a proteger a nuestros niños. Sabemos que es difícil y mientras más joven, mucho más difícil se le hace a los padres controlar al niño, y eso es parte de los challenges que tenemos. The question was, what is this increasing rate means for the schools, and what information should be to the parents? And my answer was that, again, it's the same type of answer. We do little if we only protect the children at the schools, and then they go home and they go and run wild, like they normally do. And I know it's a challenge for the parents to keep the kids washing their hands, to keep a facial covering if the parents decide that that's the best approach, to keep distance from other children. But it's a message that we have to continue to repeat until it becomes part of the behavior, where they automatically adopt those measures. Otherwise, if we keep it protected at the schools and then they go back home and everything goes back to normal, then the infections are going to continue in that age group, because it's a very unvaccinated group.
Firefighter. What is your response to some of those concerns that those firefighters have?
Well, I'll take the law enforcement first. When compared to, in 2020, 2/3 of all law enforcement officers who died in the line of duty died from COVID-related illnesses. It outpaced any other category, those dying feloniously through gunfire, etc. So far in 2021, according to the Officer Down Memorial page, if you look at the data there, about 50% or so of law enforcement officers who have died in the line of duty so far in 2021 have died of COVID-19. So a decline from nearly 2/3 to about half. And I think that part of that decline this year is attributed to the fact that the vaccine became available in 2021. And so I have been really clear that I believe that in order to protect the brave men and women who are first responders, who must respond to these calls for service, that an appropriate thing for them to do is to be vaccinated, because they do not get to choose whether they're going to respond to those calls for service where they are exposed. It is an order. It is a directive. It is their jobs, their duties to do so. So I believe that as an employer, it is our responsibility to protect them even from themselves when perhaps they may not, in order to protect the greater good, the greater society, and all of the other co-workers as well as the residents when they go into people's homes, and there's the potential for further spreading. So I spent 38 years in law enforcement, and during that period of time, I had 11 who died in the line of duty. And so I had to face a lot of families and make some tough decisions sometimes when I knew that we were potentially sending the law enforcement officers into harm's way. I would tell you that the International Association of Chiefs of Police has taken a position that vaccines are appropriate. The International Association of Fire Chiefs have also taken a position that vaccine mandates for firefighter personnel is an appropriate thing to do. So here within Orange County, we have made a directive. We're still in communication with our fire union, all of our other unions at this point, including the Fraternal Order of Police, which represents our certified correctional staff, and others have agreed to the mandate that we have put in place here within Orange County. Our employees still have time to comply with the directive. I remain optimistic that they will see the need, the benefit in protecting themselves, protecting others, and perhaps protecting their families as well. I have 2 sons who are firefighters. And I can tell you that they are concerned about when they go into the field, potentially coming home and spreading something to their families. And so that's why we urge all of those frontline workers, healthcare workers, et cetera, that getting vaccinated is, in my humble opinion, the best thing that they could do as they continue to work in this environment. And not everyone is going to agree with that. I certainly understand that. And I respect their individual rights, but I think that the individual rights do not trump the rights of all of us during this public health crisis to be unduly exposed to something that could potentially adversely impact our health and or kill us. So for the last several press conferences, I've had to come here and tell you that people who are on my staff and other county employees have, due to various exposures, have died. And last week, as I said, one died who works right in my office, who works in the mayor's office. So this is why I take the position that I take, and I'm going to continue to be an advocate for getting vaccinated, for wearing the mask mandate, or wearing the facial coverings as a result of a mandate. So this is the position I've taken. Dr. Pino?
Well, let me explain this before. I have explained this before. I'm going to do it again. Part of the side effects and what we are reading about side effects is because the number of vaccines that we have given in such a short time. So due to that, of course, you are going to see all the possible side effects because we have given millions of vaccines. Now, even with those millions of vaccines given, and even with all the side effects that are being tracked, they are minimal when you compare it to the entire number of people that have been vaccinated. Now, that's not to say that someone should not be concerned about their side effects. And that's why people who have pre-existing conditions should consult with a provider before they make that decision to see that it's adequate for them. But the firefighters, they have a riskier job than they should be concerned for a vaccine. The risk of having an adverse event happening from the daily activities is a lot higher than the one from a shot. And many of them have taken the vaccine, and many of them were part of the group that helped us to do activities at the Orange Convention Center. So we are very proud of the partnership. We hope that all of them take it, because not only they have a risky job, part of the risk at the jobs is also now being exposed to COVID-19, because they get dispatched to take care of all the individuals. So the better they are, the better we are going to be as a community. The healthier they are, the better we are being able to provide the services that we need.
Hey there, Nadine with News 6. I have a question for Dr. Pino. Dr. Pino, you had mentioned that the decrease of hospitalizations could be attributed to two things: a decrease in cases, but also an increase in deaths. Can you elaborate more on that? And also, the Department of Human and Health Services are showing huge increases in hospitalizations with children in our hospitals in the state. So can you talk a little bit more about that too?
So with regard to hospitalization of children, I don't have access to a centralized database, so I will not be able to speak on that. We do have constant contact with the hospitals, with all the hospitals, including children's hospitals, on cases and needs that they have. But because we don't have a centralized state-reported data only on Fridays, when we get it, it will not be my position to talk about numbers that I don't have verified in that way. But yes, there has been an increase in hospitalization for children, and it has been an increase in hospitalization. Any discharge from a hospital increase your inventory. And it's two ways to discharge from a hospital. You either better or you die. And that's why the number of deaths that has increased has released number of beds and ICU beds in hospitals. As that happens, sadly, our inventory of bed will increase. And it has contributed to a decrease in the number of hospitalizations in general. So a decrease in number of hospitalization, which is your input, and an increase in the output is what is determining those numbers.
This is Melissa Thomas with Florida National News. This question is for Mayor Demings. Please forgive me if you mentioned this in your briefing itself, but you mentioned there would be some unmarked vaccination vehicles. So just kind of give a little more details for our audience about that in terms of what kind of vehicles they can look for to know that those are for vaccinations.
Yeah, we had worked with Dr. Pino's office from the county and provided a vehicle that was wrapped in the I Got My Shot logo. But these other vehicles, I think Dr. Pino can share with you about why they will likely be unmarked.
Yeah. So, and I'm sorry, you mentioned that I should mention all that, and I didn't touch on that. So due to the increase of cases in the schools and our need to continue to test in the schools, we have reallocated staff from the strike team into the schools. But we also have worked with partners that will take on those activities that we already have programmed for the strike team for vaccination. So we don't want to cancel that. That's why you may see other partners and not necessarily the trailer itself, but we will be there in the days that we say we will be. It will be either us or a partner taking on these so that we have the ability to rapidly increase our employees that are doing testing in the schools. And although we will resume doing those activities as soon as we can able to do it.
Greg Fox, Wesh TV. I'd like to ask Scott Howard a question. If he can go to the podium, that would be great. Thank you. So today is the first day of your 60-day mask order. Can you please tell us, has there been an inordinate number of absences phoned in from parents today, number one? And number two, can you just tell us what you're hoping it's going to look like at the end of these 60 days?
So first of all, we haven't heard any inordinate amount of absences called in. We'll check, obviously, throughout the day and at the end of the day to see where we are. You know, our hope really is to do whatever we can to protect our children throughout the school day and for the next 60 days, and to do our part to make sure, especially those children that can't receive the vaccine at this time, are protected in school, and making sure that our adults on campus are also part of that and are masked, and we'll see. We're going to continue to look at the data, monitor it. Our COVID dashboard is out there for everyone to see and to see the cases. Mondays are high numbers, reporting days typically, so we'll see what that looks like tomorrow. But our hope is really just that we're going to do our part and make every effort to bring those cases down. And as Dr. Pino said, it's really a community issue. I mean, the schools are just part of the community, and we know that this disease is brought into our schools, and we want to make sure that we can cut down on any possibilities there to spread that. So thank you for your question. Thank you.
This next question comes in from Alexa Lorenzo with WFTV for Mayor Demings. Her question reads, Mayor Demings, will you be requiring employees to get a third dose of the vaccine once the 8-month mark hits?
We haven't made any final decisions in that regard, but certainly our healthcare experts are advising that, given the research and the data available, that once you hit that 8-month pinnacle, they are recommending the booster be provided. So we got to get past the first hurdle first, and then we'll see at a later date. So we haven't made any decisions.
And lastly, from Ryan Lynch in the Orlando Business Journal for Mayor Demings, his question reads, how much demand are you expecting for residential rental assistance compared to previous funding windows?
Well, I believe to our surprise, the demand for the rental assistance program has not been what we thought it could be. So we still have a significant amount of dollars from the American Rescue Plan that has not been programmed, and so we continue to share with our community that it is available. And as we move forward, the experience or the condition of each family may change as well. So this is, fortunately, this is something that may evolve if people going forward get behind on their rent. They still have an opportunity to make application. So we're monitoring it.
Thank you.
Okay. All right, so that was the last official question. Again, just in terms of process, so we're orderly today. We are going to do the presentations first to our media partners, and then those of you who want one-on-ones, we ask that you be patient and you stand by until we do the presentations, and then you can do the one-on-ones. So with that, we will begin that process. The next press briefing will occur probably in a week or so we'll get back with you on the precise details of that.